Welcome to my video blog for this Monday. This is Dr. Eno signing in, and today's topic is women's health updates. Now, a lot of times when I was in a private practice, I would have my male patients come in and act kind of a little bewildered when I encouraged them that it was time to get their annual physical. And I used to use the comparison of maintaining their cars to maintaining their bodies. Now, this is exactly the same thing for women. However, let's take it a step further. There are times when you get an update from your manufacturer about what's recommended for your car. For instance, something may have changed or some parts may need replacing simply because as the car goes on, or they found something wrong with that particular part, they do a recall. Well, the same thing happens with the human body. As we begin to age, there are certain recommendations that become more important than others. And so this video blog is going to highlight for you some of the recommendations that become very important, especially for women over the age of 40. So I'm going to cover 4 major areas of screening. The first is mammograms, that's screening for breast cancer. The next will be pap smears and HPV screening. The next is colon cancer screening, and finally osteoporosis screening. Now, I want to emphasize here that this is by no means an exhaustive or comprehensive list of the recommended screening. Please be sure to consult with your primary care physician or your healthcare provider. What this guideline is providing you with a roadmap so that you are well aware of what it is that's expected of you, and so that you can have a more informed decision-making process with your primary care physician, and more importantly, become proactive in your health care. As you have heard me say over the previous months and previous entries and previous blogs, our health and well-being are the foundation of who we are. Without those two, there's nothing that we can really aspire to in the world. And the goal of enhancing our health and well-being is so that we can be the best possible people on the planet, contributing toward the greater good. So let's start with mammograms. Now, a couple of years ago, actually in 2009, the United States Preventive Task Force came out with some recommendations that you may have heard of and that caused a ripple in the medical community. And that was this. The United States Preventive Task Force recommended that screening mammograms were no longer recommended for women until the age of 50. They felt that the benefits or the risks, so to say, far outweighed the benefits in women between the age of 40 and 50, particularly because you had a lot of false positives and women are being subjected to biopsies in order to determine the exact nature of abnormal mammograms. Well, they also went further to say that only women with a, in quotes, moderate risk for breast cancer should begin to be screened at age 40. Now, here's what a lot of primary health care providers would probably recommend. It's kind of hard to determine what exactly is a moderate risk, especially given the fact that we are finding a lot of young women, quite a number of young women under the age of 30, being diagnosed with breast cancer, not only breast cancer, but a fairly aggressive subsegment of breast cancer that leads to early death. So again, have a conversation with your primary care physician. Most of us do not see any problem with initiating screening starting at the age of 40. Now, let me point out that there is certainly a difference between a screening mammogram and a diagnostic mammogram. A screening mammogram is a mammogram that's done when you do not have any obvious signs or symptoms such as a lump, discharge, or redness in order to detect breast cancer that is not yet visible or not yet evident. A diagnostic mammogram, however, is totally different. This is when you may, for instance, have felt a lump, an area of redness, or a discharge from your nipple. Very important to separate the two, because irrespective of your age, if you should, for instance, do a breast exam and detect a lump or discharge from your nipples or unusual skin changes in your breasts that are not explainable, at all times bring that to the attention of your primary care physician, and more than likely you will have a diagnostic mammogram combined with a ultrasound a lot of times. So very important. And again, this is one of the areas that I like to emphasize about us getting to know our bodies, getting to become familiar with our bodies. So a monthly breast exam is something I still recommend. I know that the United States Preventive Task Force did not feel that this is something that they recommend. However, I have attached a link to teach you that will teach you how to do a monthly breast exam. Now, a monthly breast exam, the best time to perform that is the first week after the end of your period. That's because your breasts have recovered from the hormonal changes the previous month, and they're likely to be less bumpy and lumpy and painful. So when you do your monthly breast exam, attempt to do it the first week after your period. Okay? All right. Well, we're moving on to the next screening. And the next screening is Pap smears and HPV screening. Now, previously, we used to recommend Pap smears at the age of 18 or the onset of sexual activity, whichever came first. The recommendations have changed, and the current recommendations are to start Pap smears at the age of 21 or 3 years after the onset of sexual activity. So those recommendations have changed. Now, you may have been aware of HPV, which is the human papilloma virus. Now, there are certain types of HPV that have been associated directly with the risk for cervical cancer, specifically types 16 and 18. Now, by the way, HPV virus also is known to cause genital warts. Because you have genital warts, however, does not mean necessarily that you have the same types or the same genotypes of HPV that will cause cervical cancer. Now, the screening for HPV it's recommended that it starts at the age of 30. At the age of 30 years. Now, if you have an HPV screening plus a Pap smear and both of those are negative, then your healthcare provider can proceed with doing Pap smears every 3 years. However, if you have an HPV and a Pap smear that go ahead and show an abnormal HPV, in other words, the presence of the human papillomavirus type 16 and 18, however, the Pap smear is negative, the recommendations are that you have a repeat Pap test and an HPV test within 12 months. If you have an abnormal Pap smear and an abnormal HPV test, then it's very important that your primary care physician or your OB-GYN go ahead and refer you for a colposcopy. A colposcopy is a detailed test that is done to examine your cervix and take a biopsy in order to determine the presence of either low-grade, what we call low-grade intraepithelial abnormalities suggesting progression to cervical cancer or the presence of cervical cancer. Either way, this is very important to be aware of so that it can be treated early. Now, Pap smears or Pap tests and HPV are used to detect cervical cancer and cervical cancer alone. If you are a woman who has had a hysterectomy, then there is no longer any need to have a Pap smear because your uterus and your cervix have been taken out, and so there is no need any longer to have a Pap smear. The next screening I'm going to talk about is colon cancer screening. Now, colon cancer, there is a disease that affects people usually over the age of 40, and we have found that by screening for colon cancer, we're actually able to reduce the death rate from colon cancer. The current recommendations for screening are beginning at the age of 50 and then continuing every 5 to 10 years. The CDC recommends screening every 10 years. However, some authorities are recommending screening every 5 years, especially if you have the presence of polyps. Now, once again, if you do have a family history of colon cancer, a personal history of inflammatory bowel disease, which is certain autoimmune processes that go on in the bowel and cause irritation and diarrhea and abdominal pain. If you have a diagnosis of inflammatory bowel disease, then you need to be screened earlier. Please consult your healthcare provider regarding this. The next screen I'm going to talk about is osteoporosis screening. Osteoporosis is a disease of the bones, usually after the age of menopause, after a woman has gone through menopause. And this is when the bones begin to get very thin and can lead to an increased risk for fractures. Now, this becomes very important, especially as we age, because if we are to fracture critical bones in the body, like the vertebrae, the low back, the hips, or the wrist, that certainly does affect our quality of life and, more importantly, our ability to live independently. Current recommendations for osteoporosis screening are over the age of 65 years and every 5 years thereafter. Once again, if you do have a family history of osteoporosis or a personal history of anything that would put you at risk for osteoporosis, one of the common things being the use of steroids, then we recommend that you begin to get screened earlier than that. The final screen I'm going to speak about is ovarian cancer screening. Now, I know you may have heard a lot of things in the media about the need to become aware of ovarian cancer and also the need for screening. Now, first of all, pap smears do not help determine ovarian cancer screening. So that's one very important thing to be aware of. Ovarian cancer is a disease that is very hard to diagnose, and this is again once more an area where I strongly recommend that you become aware of your body. If you experience any abnormal sensations such as feeling bloated, a change in your bowel habits, this is one of the stages where you really want to go ahead and speak to your primary care provider about probably being screened for ovarian cancer. Current recommendations for screening include an ultrasound, a pelvic ultrasound. So that would be certainly recommended by your primary care physician or your OB-GYN to get what is called a transvaginal pelvic ultrasound. So these are some of the current recommendations that I outlined. Of course, concurrent with that include your routine blood tests, so to speak, your fasting blood glucose, your fasting lipid levels, and your thyroid hormone level. That is something that should be done every year, especially over the age of 50, because at times a woman may have what is called subclinical hypothyroidism, in other words, a hypoactive thyroid, and these symptoms may be masked as a feeling of depression or going through menopause. Well, I'm going to stop here. As you heard, the oven went off and it's time for dinner with the family, but I hope I've been able to provide you lots of information. And once again, there are going to be links below this blog post providing you with some resources on how to do breast self-exams and where to get more information. Have a great evening, everybody. God bless, and talk to you soon. This is Dr. Eno, again signing off, and my website is www.askdreno.com/blog. Goodbye, everybody.